الله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. Inshallah, today we are going to talk about type 2 diabetes in children and adolescents. My name is Professor Abdulmoein Al-Agha from Faculty of Medicine, King Abdulaziz University Hospital, and this presentation is available in my website aagha.kau.edu.sa. The objectives of this presentation: number one, to emphasize on pathophysiology of type 2 diabetes in children, criteria of diagnosis, signs and symptoms of type 2 diabetes, complications of type 2 diabetes, prevention and investigation of type 2 diabetes. If we look, or we need to speak about diabetes in children, type 1 diabetes is the commonest form of diabetes in children. It's composed of more than 90% of cases of diabetes in children. Type 2 diabetes in the past 20 years or 30 years ago was not existed in children. We never seen any case, or the old doctors didn't see any case of type 2 diabetes in children. But in the last 20 years, a lot of cases of type 2 diabetes happened in children and adolescents, and the number is increasing day by day. Why? Because of increased prevalence of obesity among children and adolescents. So type 2 diabetes, not common type in children, but could be seen in obese children, especially above 10 years of age. We had a third type of diabetes in children, which is called MODY, monogenic form of inherited as autosomal dominant type of diabetes. Neonatal diabetes, which is another monogenic form of diabetes with onset in the first 6 months of life. So type 1 is the main type of pediatric diabetes, followed by type 2 and monogenic diabetes. Symptoms of diabetes, whether type 1, type 2, MODY, all they have the same symptoms of polyuria, passing frequent and large volume of urine, polydipsia, drinking of more frequent amount of fluid, nocturia, waking up from sleep to pass urine, and nocturnal enuresis, passing urine on himself or herself, with unexplained weight loss. What is the meaning of unexplained weight loss? When somebody loses the weight without exercise or doing diet, with nothing, that is called unexplained weight loss, and this is one of the signs or symptoms of diabetes. Diagnostic criteria of type 2 is the same as diagnostic criteria of type 1, same as in adult. There is nothing for children different from the adult as diagnostic criteria of diabetes. Fasting plasma glucose equal or more than 126 milligram per deciliter. When we need to convert it to millimole, we have to divide on 18, factor 18 to make it in millimole. So equal or more than 126 milligram per deciliter, which is equal to 7 millimole. Random or 2 hours post-prandial glucose equal or more than 200 milligram per deciliter, which is equal to 11.1 millimole, or by doing oral glucose tolerance test, giving the child 75 gram of glucose, and 2 hours post-oral glucose tolerance test, the random glucose will be 200 milligram per deciliter. After 2 hours, hemoglobin A1C more or equal than 6.5%. All are criteria of diabetes, whether type 1, type 2, MODY. Remember that in type 2 diabetes, ketone formation and diabetes ketoacidosis could happen, but not as frequent as in type 1 diabetes. If we look into the obesity, usually male obesity called apple-shaped, the upper part of the body getting obesity first and then generalized form. In the female, when they start to have obesity, usually in the lower part of the body, in the buttocks and thighs, then become generalized. It is called pear-shaped obesity. Obesity is a major risk factor for type 2 diabetes, and the main cause of obesity in children and in adults is too much unhealthy diet with lack of exercise. So if somebody start to have junk food or no much activity, will have increase in body mass index. How to calculate body mass index? By making weight in kilogram divided by a meter square of the height. For example, if the weight is 70 kilogram divided by the height meter square, so the height is 170, 1.7 multiplied by 1.7, that is height meter square. Putting the weight 70 divided by 1.7 the square meter will get you the exact amount of body mass index. Overweight child is defined that when the BMI, calculated BMI, plotted on the BMI chart and it is more than 85th percentile, that is overweight. If a child BMI more than 95th percentile on BMI chart, that is obesity. In children, usually better to plot them on BMI chart. Different from adults, there is no BMI chart for the adults. It is the amount calculated BMI. It depends on the value. For example, normal value for BMI in an adult is 20 to 25. Overweight, when the weight becomes, or body mass index between 26 to 29. Obesity, equal or more than 30 body mass index. As mentioned earlier, because of too much calories, unhealthy food is a major factor for obesity, in addition to sedentary lifestyle. Initially, with obesity, there will be sort of insulin resistance, and then insulin resistance will lead to type 2 diabetes. Both genetic and environmental factors are involved in the pathogenesis of type 2 diabetes. Not only obesity, the child should be, or child or adult should be obese, in addition to genetic susceptibility, leading to sort of insulin receptor insensitivity to the insulin. To start with, type 2 diabetes is a progressive disease, starting initially with insulin resistance, in addition to increased glucose production from the liver. There will be gluconeogenesis, more glucose production. So it's not only insulin resistance at the beginning of the disease, it's insulin resistance with decreased glucose utilization from the peripheral tissue, in addition to increased glucose production from the liver, increased gluconeogenesis. And with time goes on, type 2 diabetes will have sort of insulin deficiency. So initially the insulin will be high or normal, but later stages of type 2 diabetes will be like insulin deficiency. At this stage, the patient will need to have insulin therapy. Type 2 diabetes, as mentioned, is a combination of obesity and insulin resistance, in addition to genetic susceptibility. Genetic factor is very important in development of type 2 diabetes, opposite to type 1 diabetes, where genetic factors is less frequent. In type 2 diabetes is very common, very frequent to have genetic factors involved in type 2 diabetes. This is what is called acanthosis nigricans. As you can see, the skin is dark and thick. Skin is dark and thick, usually around the neck and in the axilla and the groin. Why? Because of the insulin resistance. This is a sign of insulin resistance in any obese patient. Associated medical condition with type 2 diabetes, as mentioned earlier, insulin resistance is a major association. Acanthosis nigricans, hyperinsulinism, arterial hypertension, hyperlipidemia, macro and microangiopathic complication. In female, obese female, usually they might have polycystic ovary syndrome, fatty infiltration of the liver, and metabolic syndrome is major complication of obesity and major association of type 2 diabetes. Risk factor for childhood to develop type 2 diabetes: number one, if they have a first and second degree relative with type 2 diabetes. So genetic part, genetic element is very important in development of type 2 diabetes. In addition to, if the child belong to one of the high risk ethnicity or racial group. For example, Bima Indians, African Americans, Hispanics, they are higher risk to develop type 2 diabetes than Caucasian. Obesity is a major factor to develop type 2 diabetes, and if there is any other associated medical condition associated with obesity, for example, impaired glucose tolerance, polycystic ovary syndrome, acanthosis nigricans, hypertension, dyslipidemia, non-fatty infiltration of the liver, these are contributing factors to develop type 2 diabetes. Very important for type 2 diabetes to screen any obese child or adolescent. Anyone with overweight or obesity should have annual or at least 6 monthly screening for type 2 diabetes. Opposite to type 1 diabetes, there is no screening for type 1 diabetes, but there is a screening for type 2 diabetes in any obese child or adolescent. And the recommended screening test by doing fasting plasma glucose. If the fasting plasma glucose is high, then we go to doing oral glucose tolerance test. Usually in children, their body mass index more than 85th percentile, that is overweight, 95th percentile is obese, 99th percentile is severe obesity. We need to do the screening for type 2 diabetes. Acute complication of type 2 diabetes, still DKA is one of the acute complication like type 1, but usually there is something more common in type 2 as acute complication, more than common than DKA is what is called hyperglycemia, hypersmolar, non-cotitic complication, which is similar to DKA but without ketone body formation. Long-term complication of type 2, number 1 is retinopathy, cataract, hypertension, progressive renal failure, early coronary heart disease, peripheral vascular disease, neuropathy, both peripheral and autonomic, increased risk of infection. These are the same complication of type 1. So type 1 or type 2, they have similar complication. But the complication of diabetes depends on the control. Not everyone with type 1 or not everyone with type 2 will have the complication unless for long period of time persistent high hemoglobin A1C. If the hemoglobin A1C is persistently high, they are at risk of this complication. But if the patient with diabetes is always controlling the blood glucose, always keeping hemoglobin A1C less than 7% and sometimes less than 6.5%, inshallah, will avoid all mentioned complications. Chronic complications, as I mentioned, neuropathy. This is an example of loss of sensation due to damage of the neurons by the hyperglycemia. High blood glucose will lead to metabolites, and these metabolites will accumulate in the nerve cells and damage it. When the patient doesn't feel, doesn't have sensation, might have ulcers. This is what is called sensor neuropathy. As you can see, ulcers, because he cannot feel the pain. So when walk down, he's walking, he cannot feel and might have injury and ulcer formation. Also, poor control diabetes associated with the cardiovascular complication like atherosclerosis, premature atherosclerosis, high blood pressure and myocardial infarction, retinopathy and cataract, all are complications of type 2 diabetes, as well as type 1 diabetes. Nephropathy and chronic renal failure with dialysis is another complication, only in those with persistent poor control of diabetes. Prevention of type 2 diabetes, and first prevention and the most important prevention, Rasul sallallahu alaihi wasallam said, ما ملأ آدمي وعاء شر من بطنه بحسب ابن آدم أكلات يقمن صلبه فإن كان لا محالة فثلث لطعامه وثلث لشرابه وثلث لنفسه. رواه أحمد, Imam Ahmad والترمذي. This is the major lesson for us to avoid unhealthy food, avoid large amount of food. We always should have healthy average amount of food in order to avoid obesity, because obesity is a major factor of type 2 diabetes. Also, prevention of obesity comes from early age or group when the mother starts to breastfeed her child rather than artificial bottle feeding. Artificial bottle feeding is associated with obesity. Breastfeeding or breastfed children less likely to have obesity, and if they are less likely to have obesity, less likely to have type 2 diabetes. Obesity is a major modifiable risk factor. Also, we have to encourage family to have change in the lifestyle, not only the child to change lifestyle, the whole family start to walk, they have exercise, or the whole family start to have a healthy diet rather than junk food. In addition to lifestyle changes, increase physical activity is very important, reduce caloric intake, decrease sedentary life. And we have to emphasize now most of our children sitting in front of computers, video games, television, WhatsApp. Please minimize the hours of staying in front of this instrument in our house, and start to encourage outdoor activity. Treatment of type 2 diabetes, the most important part of the treatment is healthy diet, exercise, decrease sedentary life, decrease TV, video games, and texting messages through mobiles. And if this one fails, we give at least 3 to 6 months trial of lifestyle changes. If this one fails, we go to pharmacological intervention. And the best medication to reduce the insulin resistance is metformin, glucophage. Glucophage is the only FDA approved for children above age of 10 years of age. Recently we have another approval of another medication called GLP-1 receptor agonist. Victoza is another FDA approved medication for type 2 diabetes in children. Metformin was the first oral agent used for type 2 diabetes. Very important medication to improve the insulin resistance. It has many advantages. Metformin, number one, improve insulin resistance. Number two, decrease gluconeogenesis by the liver. And sometimes these patients taking metformin complaining of abdominal pain, nausea, vomiting, and that will result in decreased intake of food. It should be used carefully, metformin in patients with impaired renal function, and is the first line of treatment. Insulin is the last medication to be used in type 2 diabetes. If diet, exercise, metformin failed, the next step is to use insulin therapy in children. Thank you very much, and all of the best.